Hello and welcome to the DuckerFrontier webinar on ASEAN's Healthcare Outlook. I'm Sarah Gunnis, Managing Director of Client Services, Asia Pacific. Before we get started, we realize that some of you may be new to DuckerFrontier, so we'd like to take a minute to provide you with a very quick overview of our firm and how we work with executives at major multinationals. DuckerFrontier is a leading market and intelligence firm that provides tailored solutions to drive growth for clients across the consumer, B2B, healthcare, and technology sectors. Our dedicated teams serve as advisors to clients, delivering the market and industry knowledge they need to succeed at all points in the business cycle. With continuous research and insights, custom solutions, and transaction support services, we provide our clients a small sample of what you'll see here, with timely, actionable insights to adapt and win in changing markets. Our company is headquartered in Washington, D.C., with offices in Troy, Michigan, New York, London, Paris, Berlin, Singapore, Shanghai, and Bangalore. As part of our offering, we're excited to announce that we have recently launched a new mobile app. So if you haven't downloaded it, please do. Our Frontier View Mobile, which is available both on iOS and Android, includes all the relevant content you'll need to monitor your markets, inform strategic planning, and power key decisions for your critical markets. Having briefly introduced our company now and plugged our mobile app, I'd like to take a moment to briefly introduce our presenters on the session today. We have two members of our research team on the line. The first is Antonio Martinez. He leads the global healthcare practice at DuckerFrontier and will be sharing insights on funding and reimbursement trends in Southeast Asia and the ASEAN government's healthcare priorities in the next 6 to 18 months. The second is Ashu Agarwal. He is a senior analyst for Southeast Asia and will be explaining how the COVID-19 outbreaks are impacting the Southeast Asian economies and healthcare spending in the region. Because Antonio and Ashu are in constant contact with our clients, they'll be discussing not only the results of our research, but also what we've been hearing from multinationals who are being impacted by the coronavirus. If there are any insights that you guys see today as part of this discussion or any questions that we don't get to answer, our client services team, Raveen, Althea, Yuchen, and myself will be happy to follow up with you directly. And with that, I'd like to turn things over to Antonio to take us through the agenda and get us started.
Thank you, Sarah. And just to give everybody an idea of the agenda, we'll first start with a brief discussion of obviously starting with the macroeconomic outlook for the ASEAN 5. Again, today we'll be discussing Thailand, Vietnam, Indonesia, the Philippines, and Malaysia. Throughout this presentation. Obviously, we are going to touch base as well in terms of what we see for the COVID-19 outbreak, which obviously has different implications across the markets in the region, and obviously the potential for secondary outbreaks. But then most of the discussion today will be focusing on the ASEAN healthcare system impact, starting first with the current healthcare financing trends, and then speculating a bit in terms of what we see, what the next 18 months will look like in terms of future healthcare policy priorities in these markets. We'll finalize with a little bit of time to discuss, provide a little bit of a Q&A to answer some of the questions that may come on the line. Now, before we begin, again, in terms of the COVID-19 response, it is important to set some ground rules around our epidemiological assumptions that come with base case expectations. The first of those is that COVID-19 will not disappear on its own. The second is that there will be multiple strains as the virus mutates, but there will not be large-scale reinfection of people who already had the earlier strain. The virus will not be affected by weather to a meaningful extent. And this is the big one, an important one that impacts our expectations for these markets, is that there will be secondary outbreaks across multiple markets that reopen. But we do not expect a major simultaneous secondary outbreak that closes parts of Asia, Europe, the US, Latin America, and most of their entire economies, and somewhere we're still in the midst of that in Southeast Asia, for all at the same time. So no repeat of the March-May 2020 environment. We do expect as well that there will be some social distancing measures that will need to continue for the majority or all of 2021. That's going to be part of our base case expectations, so just repeating that. And again, this is one that for some of you on the line, may be a difference of perspective, but obviously for us, we're not making any assumptions around vaccine. We do not expect it's going to be distributed on a mass global scale before late 2021. And then we expect distribution to develop markets first with mass global distribution at some point in 2022. So that's obviously going to dictate our expectations, both in terms of the economic environment, the healthcare environment, and specifically around the financing environment for healthcare companies. And with that, I will leave you with Ashu to discuss the situation in Southeast Asia.
Great. Thank you, Antonio. Well, at this point in time, almost any presentation starts off with the current COVID-19 situation in the Southeast Asian countries. So what we have here is a chart that indicates the active COVID-19 cases across the 5 Southeast Asian countries, updated as of the 4th of August. What we can see here is that the Southeast Asian countries, or the 5 key emerging Southeast Asian countries, can largely be split into 2 categories. We have the Philippines and Indonesia, where the number of cases continue to rise and have risen to a very significant number. What we also expect in those markets is for those active cases to remain high, at least in the coming months. And so the resumption in business and economic activity will be relatively more limited in those markets in Q3 and also possibly dragging into Q4. The other category is Thailand, Malaysia, and Vietnam. These are countries that have been able to contain the virus relatively more effectively and have brought down their total number of cases to, or the total number of cases have been low enough for them to resume a lot of their business activity. But at the same time, at least if we focus on Vietnam, it is facing certain second wave of outbreaks at this point in time. So what you can see here is that even though the total number of cases in Vietnam is relatively much lower than most of the other Southeast Asian countries, and particularly when compared to Indonesia and the Philippines, Vietnam is experiencing a surge in the number of cases right now. However, because of Vietnam's quick action to impose lockdowns, to increase testing, and pursue pretty aggressive contact tracing, we expect the Vietnamese government to really be able to crack down on the situation and to contain the spread of the virus relatively quicker. And so even though the many business activities have come to a pause at this point in time, at least in certain specific parts of the country, we expect the economy to resume once again in a fairly short period of time, and hence overall minimizing the economic impact of the second wave of outbreak. Now that we have an update on the number of cases, we also wanted to dig deeper into what are the actual economic numbers that have come about from the COVID-19 outbreaks. We have surely made significant downward revisions across all of the Southeast Asian markets since when compared to our expectations before the COVID outbreaks really took place. The worst hit economy is expected to be Thailand, where we have revised our growth forecast down to negative 6.6%. This is largely because of Thailand's very significant dependence on trade and tourism. And so even though Thailand has been able to contain the virus quite effectively domestically, where the number of cases have come down to practically zero, just because of its dependence on trade and tourism, both of which are factors or drivers that are expected to recover much slower, we expect the economic impact on Thailand to be quite significant, and for the Thai economy to take relatively longer to recover. On the other hand, we have Vietnam. The Vietnamese economy is also expected to slow down for sure, but it is one of the few economies, not just in Southeast Asia, but also in Asia Pacific overall, that is expected to continue expanding this year despite the COVID-19 outbreaks. And this is largely driven by its very effective containment of the spread of the virus. As we saw in the previous chart, the number of cases in Vietnam have been quite low. And even though it is experiencing a second wave of outbreak right now, because we expect the Vietnamese government to be able to contain the virus quite effectively, we expect the Vietnamese economy to continue expanding this year. If you look at our growth forecast for next year on the next slide, what we have done here is compared our growth forecast for 2020 to our expectations for 2021. And one trend that is very clear here is that we expect all the Southeast Asian economies to then start recovering and go into expansionary territory in 2021. Now, of course, the rate of expansion really varies across markets, but the main question that really comes up here is, when do we expect most of these economies to reach pre-COVID levels? Just given our growth expectations for the second half of 2020 and also for 2021. And so on the next slide, what we've done is we've indexed our economic output numbers to 100 for Q4 2019. What that means is that you can use this chart to see when we expect various different Southeast Asian economies to reach pre-COVID levels, that is to a level of Q4 2019, at what point in time. Looking across these markets, we expect, of course, Vietnam to come out quite strong. First of all, we don't expect any contraction in that economy this year, and of course, a pretty significant contraction even next year. And the second economy that is expected to come out relatively stronger is the Malaysian economy. It has been able to contain the virus quite effectively, and very significant fiscal stimulus measures have meant that the overall structural damage to the economy has been relatively more limited. What that would likely result in is a relatively faster recovery in the country, and for it to achieve pre-COVID levels of economic output probably sometime in 2020 itself. And that pretty much sums up the two countries, or the main countries, that are expected to hit pre-COVID levels in Southeast Asia this year. The other countries that we are looking at are expected to reach pre-COVID levels only in later part of 2021 or even in 2022. So when it comes to Indonesia and the Philippines, both of those are countries that are really struggling with containing the virus at this point in time. Particularly in the case of Indonesia, the government has significantly even loosened lockdown restrictions, which are really driving a continued increase in the number of cases, which is likely to have a long-term impact on economic growth. In the case of the Philippines, the number of cases there continue to rise, while at the same time, the government is trying to put in place lockdowns to contain the virus. But because of the significant impact on the economy, and not just at this point in time, but also the structural impact on the economy from the lockdowns, the impact on the Philippine economy is expected to be to drag on for longer at the same time too. Meanwhile, Thailand is once again expected to be the country that will be most impacted. We expect a pretty slow recovery, largely because of a slow recovery in trade and tourism, and particularly in tourism, which is expected to take much longer to recover, as countries, including Thailand, are being quite cautious in opening up their international borders to other countries. Now, while the pace of recovery across all of these markets really differs, one of the things that is quite consistent across these 5 countries is that we expect a gradual recovery to begin in the third quarter of 2020. And most of this recovery is being driven by an easing of lockdown restrictions across these markets. So on the next slide, what we have is the stringency index for the 5 Southeast Asian countries plus Singapore to use as a benchmark. What you'll see here, or what the stringency index essentially is, that it quantifies containment measures implemented by different countries globally, and allows you to look at the data in a way such that you can compare how different containment measures have changed over time, and also compare the containment measures between different countries. What you'll see here is that most of the Southeast Asian countries have eased their containment and lockdown measures in the past few months, particularly when compared to the peak of those lockdown restrictions, which largely took place in the March to April period. Of course, there has been some resumption or some re-implementation of lockdown restrictions in the case of Vietnam, for example, which has seen a second wave of outbreak. And there has also been some recent lockdown restrictions put in place in the Philippines as the government tries to contain the virus once again. But at the same time, as mentioned in our initial assumptions by Antonio, these lockdown restrictions aren't nationwide and are relatively more targeted in specific parts of the country. At the same time, also, these lockdown restrictions are not as strict as the ones that we saw in March and April. And so overall, when we compare the current situation to that seen in the beginning, at the end of last quarter and the end of Q1 and the beginning of Q2, lockdown restrictions have overall eased, and that is expected to be one of the main drivers that is driving both consumer demand and also overall industrial activity in these countries. So here we just wanted to take a pause and present a question to the group. The question we wanted to ask the group here is, which ASEAN country do you believe offers the best medium-term bet for healthcare companies? The four options, of course, are Indonesia, Malaysia, Philippines, Thailand, and Vietnam. We'll pause the presentation here for about a minute to just get the responses from the attendees. Great. We have a lot of we have a lot of responses that have come through, and the clear winner in this case is, of course, Vietnam. Undoubtedly, we already saw even our expectations for economic growth in the country, where we expect Vietnam to be the only country in Southeast Asia that is expected to continue growing this year, and is also the country that is expected to pose the largest level of growth when we combine the next 6 to 18 months together. And so with that, we wanted to move over to the next section. Over to you, Antonio.
That is certainly something that companies will continue to confront as they go forward. And we'll speak a little bit about that too going forward, particularly as we talk about here, according to the issues that companies are facing around demand planning, engagement models, supply chains. But really the focus of this discussion is around that medium term. What does normalization look like? Which is the story around through the end of this year, or even for some of these markets already in that process, but it is question marks around out-of-pocket income pressures, the recovery of elective surgeries, persistent financing pressures for private providers and distributors in this environment, and the limited return of medical tourism, which again, for a few of the key markets, particularly Thailand and Malaysia, are really important factors. I think in many ways, the long-term dynamics are still one thing we'll focus on in the next section. But to give you an idea in terms of how we think through the impact on the healthcare industry in each of these key markets, I would say the biggest dynamic is to start first from the perspective of what are the past trends and priorities in these markets, particularly the prioritization of the healthcare sector and the agenda. What is the focus of that agenda? And we'll get into it a bit because in many ways, our expectations of where healthcare opportunity does not entirely connect exactly with where the economic environment is today, or even our economic projections. Obviously, a key dynamic when we're talking about demand planning expectations in these markets, funding outlook, is the infection rates. As we know, the Philippines and Indonesia are at another different level from the other three ASEAN 5 markets. And obviously as well, the key dynamic around healthcare system preparedness. One of the key dynamics is when our particular countries have made the kind of investments towards, in many ways, the universal healthcare coverage, and how quickly these financing measures can recover in this environment. Of course, we involve and discuss around the funding injections in fiscal space. We call it the macro impact on these countries, and that's going to change things. But it is also very important as we go into the long-term dynamics here is around political management and priorities. There are many of these, just almost every country here, with the partial exception of Vietnam, is compared to 6 months ago facing significantly more financing challenges. But not every country is going to prioritize the healthcare agenda and healthcare funding and upgrading of healthcare infrastructure, personnel over the next few months. Now, the final aspect as well is a reliance on fee-for-service and patient fear. And that is also going to be a big dynamic to look at as we move forward in the region, as we consistently face today. Now, in terms of the structural discussion, anytime we start with a consideration of what markets are more likely to recover, what are the dynamics that each of them is going to face, we look at it from the perspective of where is financing coming from in each of these markets. And the key dynamic is for many of these countries, and I think Indonesia and the Philippines in particular, in terms of where they are in the process of developing their healthcare financing systems. Let's just say they are in early stage of doing so. While countries, let's just say that have developed more established systems such as Thailand and Malaysia have been in a very strong position in terms of their ability to react. And obviously some of the implications around how they were able to recover, and this is true to Vietnam, particularly in its ability to mobilize, have been driven by basically their financing model as well as their ability, their mobilization of the healthcare sector. Now, in terms of the funding outlook, again, in many cases, the real dynamic is the private spending side is going to be hit harder in this environment with the level of economic pressures they're going to face. And some of the key dynamics is how quickly and how strongly can the public sector respond, continue to respond, as in many cases it already has in certain markets, but that it continues to see that implementation and effectiveness through the end of this year and in what we might describe as like basically the 2021 governing priorities and public budgets. Now, one of the key topics we discuss with just about every one of the companies that we work with is really the question around the pace of elective surgery recovery. Just about every company that we work with, one of the key dynamics is really around the question of, you're looking at each of these markets, you're looking at particularly Indonesia and the Philippines on one end, but a lot of it is the patient footfall and the willingness to come back into these markets. Some of the key leading indicators obviously are around COVID-19 infections, how quickly or not these countries were able to put everything under control. And also questions are around stringency and how that really imperils the ability of companies to come back into the market. I mean, for patients to come back into the hospitals as well. Now, in terms of the time frame for recovery, to be perfectly frank, it is very uncertain. Again, based on the assumptions that we have of the potential of secondary outbreaks, the potential of more and more challenges. And it is important to note that one of the effects that some healthcare companies have faced was a significant ability for governments to mobilize and disperse resources and financing for the necessary products for achieving the the kind of recovery that these countries needed. That was to some extent because much of the costs in the healthcare system that come with actually elective procedures or any kind of procedures, when you're seeing 30%, 50%, 60% drops in the normal operating, normal patient pathways, and obviously to a certain extent that was mitigated by measures around digital health, telemedicine, among others. Obviously, some of the dynamics around that do open as much in terms of the question of the need for that recovery, but at the same time, the real financing pressures that these the public healthcare systems will face are still to come. And it is important to note as well that when you're looking at particularly Malaysia and Thailand, you're seeing two markets that essentially are heavily, particularly on the private side, because again, the elective surgery dynamics and particularly the medical tourism dynamics tend to hit particularly the private providers, private hospitals, the private healthcare system particularly strongly. And really when companies are thinking about their 2020 as well as their 2021 expectations for these markets, and we saw that for many of you, and I think it's very much the accurate historically as well in terms of Thailand and Malaysia being key markets for growth, or for development and for business opportunities. It is also important to note that basically the recovery in medical tourism, even if you see, as some of our clients have talked about, a certain opening for certain kinds of patients, particularly say Chinese patients coming into Thailand, there is still the expectation needs to be there that even when you're looking at Malaysia, you see the Medical Healthcare Tourism Council's expectations for this year, you're still seeing a 70% drop. And as long as we are in a situation where travel is going to be difficult and challenging, obviously we know business travel is going to have a lot of time in terms of a recovery, but medical tourism, even as it already in both countries has started as of last month, it is one where the expectations need to be guarded, and also the expectations around what kind of pressure points that's going to put in terms of payments, time periods, payback periods in each of these markets and countries. But again, one of the key dynamic we would like to ask, and this is one of the points we want to put the polling question as well, because it is one where we essentially get different answers from each of our clients for the companies that we work with, is around the recovery of medical tourism. And the key question here is around Thailand and Malaysia. When do you expect medical tourism to reach pre-COVID-19 levels? And we'll just give you 1 minute to provide a bit of feedback in terms of the expectations on this front. Hoping everyone's had an opportunity to respond. Okay, the second half of 2021. Certainly that is one, let's just say, a little bit more likely than say some of the expectations that we've heard from some of our clients. And we'll talk a little bit about it a bit later in terms of what the governments, particularly governments of Thailand and Malaysia, are doing right now to attempt to speed up that process. But I'll turn it now to Ashu to talk a little bit about the fiscal condition situation in some of these key markets.
Great, thank you, Antonio. Well, those polling results were surely interesting to see, and that delayed recovery in medical tourism will surely put pressure on the overall healthcare system in Thailand and Malaysia. And at the same time, what we are also seeing is that the healthcare systems in Indonesia and the Philippines are also expected to experience significant pressure, though for slightly different reasons. One of the major ones is just the lack of government support at this point in time for hospitals. So if we focus on the current situation of COVID-19 and some of the specific resources that governments have mobilized to support healthcare or hospitals, we can see in the case of Indonesia, the Indonesian government came up with a total fiscal support package of close to $55 billion, 5.2 billion of which was allocated towards healthcare spending. But the issue in Indonesia at this point in time is just the very low level of disbursement in the market. And so as of end of June, 98% of the resources for healthcare had not even been dispersed to individual hospitals. And this is at a time when a lot of hospitals are struggling financially because of constraints in the financial sector, because of increased costs, because of them having to service and cater to COVID-19, increased number of COVID-19 patients. And so a reduced or lack of support from the government will surely have a significant impact on their operations. There has been reports of slightly higher level of disbursements, at least in the month of July, because of the significant pressure on the government, because Jokowi or Joko Widodo, the Prime Minister of Indonesia, has put pressure on its cabinets to start mobilizing some more of those funds. But even then, the reports right now for healthcare spending related to this package, the disbursement levels are still about 30 to 50%, significantly lower than the $5.2 billion that has been allocated, putting continued pressure on hospitals. In the case of the Philippines, we have seen hospitals consistently complain over debts paid due to them. We can see that the level of reimbursement to hospitals has reduced over the years. And particularly in 2020, even before the COVID-19 outbreaks took place, when the Philippine government finalized on its budget for the year, the government allocated significantly lower budget to PhilHealth, which is the institution or the organization that really manages the universal healthcare program. It allocated it significantly lower resources than it had asked for. What that means is that PhilHealth is likely to be quite constrained when it comes to its financing, putting further pressure on its ability to be able to clear up its debts and finance private hospitals. If we zoom out and look at the overall condition of the healthcare systems, we can see that healthcare systems have been performing quite badly in Indonesia and the Philippines. In Indonesia, pretty much since the BJPS has started working on the universal healthcare program, and the BJPS is here the organization that is really managing the universal healthcare program in Indonesia, it has been recording consistent deficits. And those deficits have really increased to a very significant level as of last year. Now, because the central government will plug this deficit only for so long, the BJPS is experiencing increasing pressure from the central government to start plugging its deficit on its own. For this reason, it is having to look at measures that would increase its revenues or cut its costs. It has implemented a number of different things to be able to do that. One is a rise in premiums, but we'll go into that in just a few minutes. But the other measures have also been to reduce certain drugs from its formulary, to downgrade a number of hospitals, which basically means that hospitals will be receiving less funding from the BJPS than they did before. And also certain other measures that are aimed really at cutting down on cost. What that indicates is an increased focus on cost by the Indonesian government at this point in time because of significant financial constraints, not just in the overall government, but particularly also in the BJPS. In the case of the Philippines, Philippines has recorded consistent surpluses in the last few years, as you can see in 2017, 2018, and 2019. But things are starting to change this year. And this is, of course, to quite an extent driven by the COVID-19 outbreaks. what we have right now is the data for Q1, and we can already see that that surplus has been eroded, and the government of PhilHealth has started recording some deficits. Since we have seen that the overall situation in the Philippines has worsened in Q2 and is expected to be the overall economy is expected to be quite weak even in Q3, we expect the situation to get even worse. On top of that, what the government has decided is that it will make voluntary the payments into the healthcare system that have to be made by overseas foreign workers. Since the Philippines has a lot of overseas foreign workers that go out to other countries to work, this is expected to have a pretty significant impact on the overall amount of contributions that will come into PhilHealth. What this once again means, very similar to the Philippines, is that PhilHealth will record a significant surplus, and it will put increasing pressure on PhilHealth to start cutting down some of those costs. Now, one of the ways that governments are looking to manage this is by increasing premiums. The Indonesian government has particularly taken some very significant actions on that front. You can see some very substantial increases in the premium rates across the different classes of the universal healthcare system in the Philippines. However, this is being done in a current recessionary environment. What that means is we don't expect patients to start paying that increased premium, but what we expect to happen instead is for those patients to start downgrading the insurance plans. Ultimately, the difference between the first class, second class, and third class insurance plans is not really any difference in the healthcare services that that are available to them, but instead it is just a difference in the accommodation that they have available when they are hospitalized. As a result, we expect some significant downgrades in the healthcare class or the healthcare insurance classes. And so we don't expect a very significant impact, or we don't expect the increase in revenues to really be enough to plug the BJPS deficit. In the case of the Philippines, the government is planning on increasing these premiums, but once again, it's going to face pressure because it has now excluded foreign workers from paying the increase in premiums, and also because of the significant rise in overall unemployment levels, a reduction in salary levels. All of that is also going to have an impact on the funding for PhilHealth. Overall, hence, because of all these factors mentioned in the last few slides, what we're expecting in Indonesia and the Philippines, at least for the next 6 to 18 months, is a significant focus on cost for these governments to try to reduce their overall expenditures, for this to also limit their ability to expand coverage, both in terms of the proportion of the population covered under the universal healthcare plan, and also in terms of what are some of the treatments and procedures that are actually covered. If you look at some of the other markets in Southeast Asia, we do see certain positive trends. So even amid the COVID-19 outbreaks and also the current recession that is taking place in many of these markets, Vietnam has been able to expand its overall healthcare, universal healthcare plan. We can see that the overall share of the citizens with healthcare insurance has increased even in the first half of this year, which is when the major outbreaks in these countries were really taking place. In the case of Thailand, the 100% of the population is already covered under the universal healthcare plan, and so they're not really looking to expand that any further. That's not what they're focusing on, but what they're really focusing on is expanding the coverage or the treatments that are covered under the plan. And so even at this point in time, when the government is facing increased fiscal pressure, when it is going through a recessionary environment and is expected to be one of the worst hit economies, the government is still focusing on expanding the overall coverage and the treatments and the procedures provided. And it's trying to become a sort of a medical hub, at least in this region. And so what we expect is for the Ministry of Health in Thailand to continue to have that focus and for it to continue expanding some of the procedures and treatments that are covered under its plan. With that, I'll pass the time back to Antonio to talk about some of the priorities for the governments in Southeast Asia.
So obviously very much a mixed story when one's discussing basically what the economic circumstances, the COVID-19 environment, but it is also one where basically every government in this region is going to at least have to assess, with the only partial exception of Vietnam, assess what their priorities need to be over the next 12 to 18 months, obviously confronting still the impact, the direct impact and the indirect impact of the COVID-19 crisis. Obviously, key questions will be about how much the focus will continue in certain markets. And again, it's a mix, it's a divergent story, as I'll just get to when it comes to our expectations for Indonesia and the Philippines. But basically in most markets, a focus on cost is going to expand, with only some markets really kind of the question mark becomes around the focus on improving quality of care or value of care over the next 18 months. Now, this isn't just basically an assessment of where we have seen, and this comes from our analysis of statements from government officials, ministries of health, social security institutions, other policymakers or stakeholders across these healthcare systems in terms of how it has shifted relative to 6 months ago, relative to the pre-COVID world. And I think the clearest demonstration of that is that for the most part, with the partial exception, two exceptions that I will just mention in just a moment, in Vietnam, essentially, whatever you believed about this market 6 months ago, whatever your assumptions around Vietnam 6 months ago are still largely true. The only aspects that have changed is an increasing acceleration or focus on accelerating already measures around telehealth and electronic medical records that were already under play or in development by these governments. And again, our big focus is around government players when we're making these arguments here. And that's really the story around Vietnam, and also more of a focus around local production, which for a lot of companies in the healthcare space, Vietnam is only becoming more interesting. And obviously, we're not talking out of turn on questions around global supply chains in the healthcare space. That is certainly a key driver of interest going into Vietnam, not just from Western developed market companies, but from Japan as well. Now, when we're looking at the other markets in the region, when we're talking about the Philippines, there actually will be, and we expect to see a continued focus around cost. We do still expect, we've already seen this, there's going to be continued focus on price controls and expansion of those to more and more potential pharmaceuticals, particularly those that the government, that is a big part of what the PhilHealth as well as the Ministry of Health spends on. But at the same time, it has become clear during this crisis that the general consensus within the government, within the opposition as well, within many of the key stakeholders, is only an increasing focus on access and continued doubling down on this front. Now, there are a lot of question marks when it comes to Philippines because of some of the political dynamics we'll talk about in just a moment, but that is important to note. In Thailand, we will continue to see that increasing focus on cost, but at the same time, within the dynamics that we have seen because of Thailand's, let's just say, focus on continuing to develop its what it has seen as its successful response to the COVID-19 outbreak because of its healthcare system, is going to be a continued focus around quality and access. We've seen what already from the NHSO will continue to support the universal healthcare system there. Malaysia is going to be a country where, let's just say, coming a little bit ahead of time, but where there's still a lot of uncertainty, mostly because of the political dynamics in the market today. But basically, we do expect continued focus around, an increasing focus around cost, but still probably less of more uncertainty around whether you're going to see real change around quality and access concerns. Indonesia is going to be one market that is at the other extreme. This is one market where, because of the economic conditions, the economic situation, and because of, let's just say, the focus in recent years around essentially confronting the financial challenges of its universal healthcare system. This is one that can be quite problematic, particularly not just because of the economic effects, but in terms of the outlook in terms of government policies. Now, the important point here to start with, and we did mention it earlier in this presentation, is the previous priorities and the political calendar are going to drive a lot of the medium-term healthcare responses. When we're talking about Malaysia, and we'll talk about it a little bit closer, the current fragmentation of the government has led to, relative to our expectations even in January of this year, to a lot of uncertainty and lack of policy direction, and in the sense, an unwillingness to put forward big initiatives. And we'll talk about that in just the next slide. Vietnam, again, it has had what you might describe as a good, if any country in the world has had what might be described as a good crisis, Vietnam is one that can say that it had because of its response to COVID-19. Now, it is important that the Politburo, the government right now, is continuing to focus on the development of the healthcare sector with, again, a lot more focus both in terms of spending and manufacturing, but essentially the status quo process to a great extent will continue over the coming 12 to 18 months. And we are seeing basically a shift in leadership next year. So any kind of major initiatives, even if they want to shift direction, is probably still, at least you can expect 12 to 18 months away. The Philippines, and this is one of the key takeaways you should have from this presentation, is there is no country here in Southeast Asia that has made it clear that the #1 priority in terms of focus, in terms of investment, will be the healthcare sector. Now, we can argue about implementation, we can argue about financing, and there is a significant political controversy in the Philippines between the government and PhilHealth. Now, again, that is going to be a key dynamic that needs to be decided, but basically you should be expecting the next 18 months a big focus around healthcare. Thailand, again, the key dynamic here is the focus of this current administration had been almost entirely around pushing co-payments, more cost shifting of the healthcare system. Now, it's similar to some extent to what you also see to some extent in Indonesia in terms of reduction in benefits, but let's just say that agenda has been delayed. And again, key dynamic is when that will come back, still very much uncertain. Indonesia, on the other hand, obviously it has been a key priority for this government, and it's going to continue to prioritize over the long term. But if we're talking about the economic response, the focus will be on infrastructure over healthcare financing. Now, I had mentioned earlier around the political conditions in Malaysia, and always the discussion around healthcare reform in Malaysia is always a complex and difficult one. But the key dynamic here when you're looking at this market is, at the beginning of this year, we had the expectation and the beginning of talks around an agenda of significant public sector transformation, private sector regulatory reforms, and more, as importantly, the sustainable health financing system. Again, every other approach has largely historically failed in Malaysia to shift the system. But if you want to see a significant expansion, both in terms of the government as well as in the private sector, that, let's just say, has been transformed mostly because of the political dynamics and the fraught situation in the healthcare sphere, to an agenda that, at least as of right now, is mostly focused on, let's just say, more preventative wellness measures, kind of very broad and to some extent abstract, and long-term vision for healthcare, which is not necessarily a negative, but in many ways makes unclear what the agenda will be in terms of making major changes to the system. Now, again, there will be continuity around implementing pool procurement, bolstering local manufacturing, implementing external reference pricing for originator drugs, continued support for deregulation of consulting fees for private providers, which was to some extent part of the agenda around shifting the healthcare system, but that remains still a work in progress. The Philippines has been, as I mentioned before, one market that has become very clear on what the agenda is going to be in terms of the healthcare sector. Now, you're looking at these numbers here on the left, and it seems, well, you seem to be looking at numbers that look a little bit on the low side, but that's just because it's the cash-based budget ceiling. What we see in terms of the expected priorities, and this were basically written in the first draft of this budget for next year. Again, the focus will be on upgrading, expanding spending on medical infrastructure, sustaining the budget for regular health programs. Important here, focus on mostly preventative, primary care, communicable diseases, maternal, newborn, and child health, not necessarily some of the non-communicable diseases as focus areas. Again, the COVID-19 response continues to be very important. There is a focus on increasing the budget to improve health systems, particularly around disease surveillance. This is not something that's only the Philippines. We see that across the board in ASEAN, in Asia, in emerging markets as a priority. And you're also seeing continued support for PhilHealth in terms of sustaining the budget, drafting a national basically human resources management for the healthcare sector, as well as ensuring budget for the implementation of the USC law in the first 1,000 days. The key dynamic of controversy is that PhilHealth today wants to delay the implementation for a year of the universal healthcare plan, the basically primary care benefits increases. The government does not want to do that, but it is going to continue, and this is where, let's just say, a source of optimism around financing for Philippines versus Indonesia. There is an agenda to focus on healthcare, and that does provide a certain amount of opportunity. Now, when we look across the region, when we look at, okay, 2021 healthcare sector priorities across ASEAN, and these are based essentially on what we've heard from government officials, what has actually been on Ministry of Health plans, in many cases very clearly the plans from government and other key stakeholders in the healthcare system. Again, the key focus here is that there is a lot of uncertainty for Malaysia, but there are countries where, let's say the Philippines, Thailand, Vietnam, a continued focus on COVID-19 coverage and financing levels. Supporting digital health is a story for most of these markets. We expect it as well as Malaysia, even as it's a market that, as we'll get into in just a little bit, needs to do some regulatory updating of its regulations for telemedicine. Now, the focus on upgrading healthcare facilities, as of this point, there isn't a clear dynamic where we're seeing anywhere but the Philippines of what this might look like, with the partial, let's just say, exception, particularly for medical tourism purposes, of Thailand, where both Thailand and Malaysia do see it as part of their, let's just say, not the next 6 months, but the next 18 months, 2 years agenda of recovery for medical tourism. Now, for some of these markets, it is also a question around boosting support for healthcare practitioners. As some of our clients have put it, a lot of the resources in some of these countries, the emergency resources, were about supporting wages, revenues in these markets, not necessarily for treatments. But it is important that that is also going to be part of the agenda for at least Indonesia and the Philippines over the next 12 to 18 months. Now, the support for local production, we'll talk a little bit about it towards the end of this briefing. It is something that we hear more and more from more of these markets. ASEAN will be a region that's, particularly for the healthcare space, obviously for PPE, for many other dynamics, for many other segments in medical devices and pharmaceuticals, where there will be the desire and the focus to really establish both for, to a certain extent, for access to lower costs healthcare products, but also around taking advantage of, let's just say, fear around China. And dependence on supply chains with China. That is also certainly going to be a part of the strategy going forward. Key dynamics also around improving the finance base, not just what we had before, but obviously as you look at, particularly as clients want to see more of a investment in certain, particularly in markets such as Malaysia and Thailand, when not communicable diseases are becoming obviously a much faster, a much bigger importance and much faster within the region. That is where you want to see an improvement in the financing base as a key part of the strategy going forward. Now, around digital health, and I do want to just kind of make sure we end on time and have a few minutes for questions. The key dynamics here is that for some of these markets, it's really a question around, as much as there has been an enormous amount of activity on the private side, startups, the use of telemedicine, the emergency allowances, the guidelines, a lot of activity. There is still work to be done in terms of instituting, both in terms of clinical guidelines, as well as instituting payment and funding mechanism, particularly reimbursement mechanisms in these markets. While the next 18 months will be a situation where, to at least some extent, a lot of that digital, that telemedicine opportunity is here to stay. The question of the level of take-up of those, and really what for many of companies are about a transformation really in terms of patient pathways and disease management, is still, let's just say, there's a lot of regulatory work that needs to happen over the next 6 months to 18 months for that once we get past this COVID-19 situation, for it to continue to stick. Now, around localization, in terms of sourcing and localization pressures, again, for some market, it is going to be the continued focus on boosting local content requirements, seeking to ensure continued access to the right levels of personal protective equipment and national stockpiles. But it is also, for many of these markets, around ensuring continued access to global markets, because they want to be export platforms for these sets of products at the same time. So it is a situation of some complexity, but also a lot of opportunity. And certainly Vietnam is one that is certainly an emerging opportunity for a lot of healthcare companies going forward. I know we've gone a bit almost to the top of the hour. I want to stop here and see if there's any questions on the line.
Yeah, thanks, Antonio and Ashu. Very insightful from you both today. We do have a couple questions coming through. I know that we're almost at the top of the hour. So if we don't get to your question today, we'll be sure to share some answers with you following this session. But maybe I can at least start with one and see what we have time for. Here's one for you guys. What are your expectations about the recovery of travel and tourism in Southeast Asian countries, particularly if we're looking at Thailand and Malaysia?
Yeah, I think that's a great question, and we saw from the opinions of people on the webinar today that most people expect a recovery about the second half of 2021, and those expectations seem realistic to us, except for we have a slightly downward bias or a later bias in our expectations. We expect a recovery to possibly drag on to also 2022. What we also expect in the meanwhile is, as the infection rates in Thailand and Malaysia, and also in the source countries such as the Middle East, the US, and Indonesia, for example, evolve, we expect medical tourism and overall travel and tourism to keep turning on and off. And so governments in Malaysia and Thailand are likely to keep changing the policies about letting people in, as infection rates are expected to sort of be cyclical and for them to change over time once again in both Thailand and Malaysia, and also in the source destinations.
Great, thanks Ashu. Excellent. We have a couple more coming through. What prospects do you see for the vision of value-based healthcare for Southeast Asia? And which countries are more likely to be open to this approach?
Another great question, and something we surely hear a lot about from the clients or the companies that we work with. One thing that is for sure is that most of the Southeast Asian countries, most of the governments are facing pretty significant fiscal pressure at this point in time. And because of that increased fiscal pressure, we do expect a focus on cost across most of the Southeast Asian countries. But at the same time, there are probably some pockets of opportunity, and I think I'll just maybe let Antonio elaborate on that a little bit?
Yeah, what I would say here, in terms of opportunities for value-based healthcare, I think some of the dynamics around that will depend on investments around essentially both, basically not just the healthcare financing, which I think is going to be key in markets, even markets that have generally obviously been seen as relatively developed within these ASEAN 5. You're going to need to see significant financing changes, particularly in a market like Malaysia. Now, if you want to see a shift in the mentality towards these other needs, obviously some of that will come after you see the investments that markets like Philippines, where it's going to move in the right direction, and Vietnam, where it's also moving in the right direction. If you get that level of financing correct, you then can really start shifting the discussion, especially as the population's needs start to change. You really start seeing a situation both from investments on that front, from investments on integrated healthcare data systems, and not just simple ones, but really ones where you can really start getting some real demonstrations of the potential economic benefits, and having that access to data will be key. Then you can start seeing a shift in the mentality, because what often happens in these kind of economic situations, and this is a healthcare crisis, so it's somewhat different than, say, comparisons to other regions and other markets that have faced these kind of financial challenges, is that it still creates, let's just say, a dynamic of further discounting, further price controls, further ways of driving some level of reimbursement controls. So there will be opportunities. Obviously, but you need to see kind of the political agenda start to shift, and the investments around digital health really starting to, and part around healthcare data really starting to bear fruit.
Great, thanks Ashu, thanks Antonio. I think we're a little bit over, so I just want to thank everyone, all the participants on the line. If there are any questions that we didn't get to answer on the line today, we'll be sure to follow up with you directly. Also, feel free to reach out to your client services manager if there's anything you have additional questions on, or you'd like additional detail. Thanks again to everyone, and we look forward to speaking with you again soon. Take care, stay safe.